Good afternoon, everyone, and thank you for attending our candidate forum for the riding of Kitchener Centre. My name is James Sebastian Scott from City News 570, and I'll be the moderator for today's discussion. The Chamber takes its political process very seriously as they are nonpartisan and work with all elected officials municipally, provincially, and federally. These candidate forums are an important opportunity for our members and the community to hear about issues of concern and importance to the business community. This is the second of 4 events organized by the Greater Kitchener-Waterloo Chamber of Commerce in advance of the June 2nd vote. The forum for the Kitchener Centre ridings will be held on Thursday, May 19th, Kitchener South Hespeler and Kitchener-Conestoga ridings will be held on Thursday, May 19th, and we already previously did Waterloo this morning and now Kitchener Centre this afternoon. I want to thank our title sponsor, Kitchener-Waterloo Association of Realtors, and our media sponsors, City News 570 and Rogers TV. The format for this event will be 90-second introductory remarks from each candidate, followed by questions in priority areas identified by the Greater Kitchener-Waterloo Chamber of Commerce through their advisory committees and responses from the membership at large. The questions will be asked in rotation. The moderator reserves the right to terminate answers where appropriate or to grant additional chances for candidates to speak to ensure fairness in speaking times. At the conclusion of the forum, each candidate will be allowed 1 minute for closing remarks, which will proceed in reverse order from opening remarks. We will now commence with 90-second opening remarks. The candidate order as determined this afternoon is Wayne Mack from the Green Party of Ontario, Kelly Stice from the Liberal Party of Ontario, and Laura May Lindo from the New Democratic Party of Ontario. Wayne, will begin with you with opening remarks.
All right, thank you very much, James. I just want to kind of set the stage for our panel discussion here of thinking about the future we want and the policies we need to get there. So I hope as you're listening to me, my fellow candidates, you can see the different visions that we have for the future and see how we may differ, but we all really want to lead Ontario into a better future, Kitchener Centre to a better future. So for me, I really care about sustainability as part of the Green Party. It's not a surprise. As a software person here working in Kitchener Centre, you'll see a lot of what I am framing these questions around is like, how do we see this in generations, not just years? And I look forward for all of you to hear all of our responses as you make your important decision on June 2nd.
Thank you, Wayne. Kelly, we will go to you for opening remarks now.
Great, thank you. Thank you so much. And thanks to the Chamber of Commerce for putting this together as an opportunity to share a little bit about who we are, but also about the platforms that we represent. It was about 6 months ago when I put my name forward. And there was a few things that culminated into making that decision. I have worked for the last 20 years for the City of Kitchener. And I can tell you that the last minute chaos on a Friday afternoon when we were getting notification of major changes that needed to be made that impacted the lives of everyone, I thought, I can't stand by that anymore. I needed to do something. And it also happened that I was at an event with Stephen Del Duca, and at that event, he talked about dignity. He talked about inclusion, and he took the time to listen. And that has actually built the framework for our policy, where we have had the largest consultation ever in the history of the Liberal Party to understand what Ontarians want and need. And that is what we have put forward. And I am so pleased to stand here today and answer some questions. Thanks so much.
Thank you, Kelly. Laura May, we'll go with you for the last opening remark here.
Thank you so much. I am Laura May Lindo, and for the last 4 years, I was the MPP for Kitchener Centre. A lot of people have asked me how my name landed on the ballot. Some people don't know that I had a finance background, and then I was in the academic world. But I do want people to know this. I had a conversation with my uncle. My uncle is Dr. Alvin Curling. He was the first Black elected Speaker of the House in Ontario. And when the NDP approached me and asked me if I would consider putting my name on the ballot, he said to me, always remember this. Every single party wants the best Ontario that they can have. but they have different tools to get there. So choose your tools. And I think that that is a fitting way to begin this discussion, because what you are going to be hearing are different tools and strategies to ensure that we recover well from the pandemic and that we build the province that we need, and the communities, and have the advocates that we need from our community at the provincial table at Queen's Park. So I'm truly honored to be here. I'm excited to speak with both Kelly and with Wayne, and I can't wait to get started.
Excellent. Thank you very much for the opening remarks. We will begin the question and answer portion. And for the first question, we will be talking about emerging from the COVID-19 pandemic. And the first question Kelly will answer, and then we'll go in the order from there. So Kelly, the first question is, businesses have experienced numerous shutdowns and restrictions during the pandemic. How will your plan ensure that future disruptions will be minimized in the face of future waves?
Well, thanks, James, for that question. And I think one of the things that we have seen coming out of the pandemic is that we can't operate in silos, that it is so important that we find ways to coordinate and find ways to work across party lines. But the Liberal Party does have a commitment to address some of the businesses, the small businesses that have been hit hard through this pandemic. And there are a couple of ways that we are looking at doing that. And one of them is to eliminate corporate taxes for small businesses for 2 years. We also want to fund programs that are going to help small and medium-sized businesses go digital, because going digital can create some efficiencies. And we also want to make some strategic investments to hard-hit industries like tourism, music, culture, and sports. And really knowing that music and culture can be the life of a community. And it can contribute to a positive health and have positive health impacts for not only our community, but for individuals.
Thank you, Kelly. Laura May will go with for your first answer to the question about how do we prevent the future waves and what your plan is for that.
Thank you so much for that. I think at base, we need to understand the impact of the pandemic on small and medium-sized businesses, especially those that were impacted by the shutdowns, and not just the shutdowns, but the contradictory health and safety measures that were being presented to small and medium-sized businesses throughout the pandemic from the Conservative government. In our platform, we often talk about investing in people. And I think a lot of people believe that that means that the NDP is solely concerned with investing in the social services that people engage in. But what I learned when I was sitting as the MPP was that people are the ones running the businesses in community. And when we don't invest in people, whether it's in healthcare, in mental health supports, in small business grants, all of which are things that are part of our platform that I'm sure we'll get to in the other questions, businesses suffer. If we don't make sure that people have what they need to thrive, then they're not able to create the innovative business models that we know Waterloo Region is known for. The last thing that I would say is that as we are in this opportunity to rebuild post-pandemic, we also have another opportunity, and it's to rebuild in a way that greens our economy. And I think that businesses are ready, in the words of Beyonce, for that jelly. And it's time for government officials to also take seriously the kinds of investments that people need, not just in moments like a pandemic that nobody anticipated, but also for the future when we think of building the communities that we want and need.
Thank you, Laura May. Wayne, I will go with you for the question about how we prevent this in your plan.
Yeah, so and talking to a lot of the small business owners, at least immediately around where I live downtown, a lot of parts that come up is access to skilled labor. Skilled labor shortage has been a lingering effect even before this government, this current government. And the Greens have always championed the idea of modernizing the apprenticeship system. So having a centralized electronic place that trade students can be matched with journeymen who want to take them on, and also trying to build more like stronger incentives for journeymen to take them on. if we're going to green our economy and be part of the climate economy, it's going to take a lot more skilled labor as we retrofit everything. And we want to give grants and loans to small businesses and medium-sized businesses in order to give them the tools to lower the amount of hydro they use, for example, or to do more environmentally friendly initiatives. With this, we're going to need more skilled labor, and we, as Ontario, and even within Kitchener, can be leaders in this. It's going to be a need into the future, so we can play catch up, or we can be ahead of the curve here. So uh, from emerging from this pandemic, shoring up the amount of skilled labor that we have, investing into people of that concept is a big part of what we plan to do for businesses going forward.
Thank you very much. The next question, first it will be Laura May who will answer this next question. It feels like the hard-learned lessons from SARS were forgotten by the time COVID-19 hit, and we paid that cost in deaths, delayed health procedures, and a closed economy. Put funding aside for a moment, how will your plan ensure that the lessons learned from this pandemic aren't lost as the public's mind moves on?
Oh, that's such an important question. Thank you for that. It's foundational to how we rebuild post-pandemic. One of the things that I was advised of very early on, I had doctors, local doctors that were actually sharing with me the plans to navigate SARS and comparing those to the plans to navigate the pandemic that were being brought forward by the Conservative government. If we don't have a government that thinks proactively, that makes sure that the investments are made in our healthcare system, for instance, to ensure that PPE is already available, that they're monitoring the expiration dates on the kinds of health prevention mechanisms that we need, then when something unexpected hits, we are never prepared. And so part of the plan for the Ontario NDP is to ensure that we do a thorough review of everything that happened during the pandemic. And we've seen little bits and pieces of that review coming out, but we have to take a step back and think about what was already failing us, because we know that there was a lack of investment in healthcare prior to the pandemic, and that was causing more problems on the ground. It also didn't allow small businesses to figure out where to get the PPE that they needed during that emergency in order for them to keep going. And so I think the review is critical, and building relationships that rebuild the trust between the healthcare system and government, as well as small businesses and the healthcare system, as well as government, is going to be very, very critical. So we need to make sure that we elect folks that are at the table, that are ready to listen to the hard truths about what went wrong, and work collaboratively to build new truths so that we're better prepared in the future.
Thank you. Wayne, put funding aside for a moment, and how will your plan ensure that the lessons learned from this pandemic aren't lost as the public's mind moves on?
Yeah, so a lot of it is the people at the table, the people that we elect, having people that think long-term and not just a few years. But also to mitigate that, we do have an emergency preparedness team, and having that sustained over time is really important. At the end of the day, we really need to change the systems that incentivize a lot of short-term goals and gains. And if we think of a system that more incentivizes this long-term amount of knowledge transfer of what we've learned, um, uh, for example, maybe changing an electoral system that is more collaborative and representative can go a long way to just keeping that knowledge over generations. But it can start as simple as the people that we bring in, that they think long term, because it won't be just SARS and that crisis coming into as another medical pandemic. It could be another environmental crisis. Floods happen over and over in the same areas sometimes. Fires may happen in the same areas over and over sometimes, and being able to keep that knowledge transferred and use lessons learned, and communicate with people who are experts in this. For example, with fires, Indigenous communities had controlled burns in the past. Keeping them in not just in the conversation, but shaping it. Having that kind of culture is just really important. I hope that we can develop this long term as a society, so we can think in generations.
Thank you. And Kelly, a final response from you on putting funding aside and how you're planning to ensure that the lessons learned from the pandemic aren't lost as the public's minds move on.
And I apologize if I've been in and out. My internet's been a little bit unstable, so I'm hoping I can get this answer in without losing it again. And but I think one of the things when I hear that question, I think one of the opportunities that we lost in this pandemic and that we need to pay attention moving forward is that there are opportunities for us to solve Canadian problems or solve Ontario's problems with Canadian and Ontarian solutions. And that was one of the things that we saw, and we are still seeing our impacts to our supply chain. And so, moving forward, we're going to have some tough conversations and some important conversations about how do we make sure that our systems are ready to respond for and when this happens again. I think, Wayne, you refer to it, that there are we see this, the flooding. We see changes in our environmental system that will really have an impact on us moving forward. And so we need to take a step back right now and say, okay, where are our greatest exposures? And how do we shore up with the talent and the knowledge that we have? I know we have smart people in Kitchener Centre and smart people in Waterloo Region. I've met with Communitech, and as I'm sure many have. And my goodness, what a minefield in which to connect. And again, working, not in silos, but collectively, because we know that, and we experienced through the pandemic that this pandemic had a disproportionate effect on different people. We weren't all in the same boat. And so we need to really pay attention moving forward to, what are we going to do? How can we leverage better approaches and better solutions for all people in our Ontario and in Canada?
Thank you. The next question, Wayne, we'll start with you on this. The great majority of Ontarians are fully vaccinated. When it comes to mandatory vaccinations, however, there are concerns even among the fully vaccinated. In what settings or under what circumstances would your plan require vaccinations?
My current take is where people are most vulnerable, and we need to have defined thresholds in which these vaccine mandates are necessary. Right now, we don't have any testing. We don't even know the rate of COVID in our area to an accurate degree. So it's very hard to pinpoint, enclosed vulnerable spaces like long-term care homes. We just don't have the data in order to make any sort of accurate decisions. We would need to bring back testing for people who are sick just to get some sort of data-driven threshold for having these mandates in place. So until that's the case, what's currently in probably needs to stay unless there is a decent decline in our wastewater system, which is really our only way of determining COVID in our community right now, which is a very, very lagging indicator. Right now, what's currently in place will stay, in my opinion. But until we have more data, it's very hard. It's very hard to give a very clear answer about when's the right time to put it in and when's the right time to have it lifted.
Thank you. Kelly, with the great majority of Ontarians fully vaccinated, and what settings or what circumstances would your plan require vaccinations?
Thanks, James. And James, I do appreciate you repeating it for each of us, just to reorient it back to the question at hand. So yeah, I think it's very clear that our party has talked about believing science and feeling that over this pandemic, perhaps the belief in science wavered because different decisions were made, and there were different rules for if you were part of a big box store, perhaps the rules were a little bit different for you if you were a small business owner, which I found very curious over this pandemic. But what I do know as well is that there is some hesitancy in my role as a City of Kitchener staff person. We were working with the region because I have the privilege of working in community centers where we get to work with very diverse communities in all aspects. And we recognize that there's some hesitancy. And I think, it's important to step back and understand, okay, why is there this hesitancy? What is contributing to that? And then how can we move the needle to help people understand the role that vaccines play and the importance, and really look at how do we make sure we're keeping the community safe. Our party has talked about adding the list COVID-19 to the list of universal vaccines in the school system. But I think, what that headline sometimes doesn't have the secondary aspect to is that, which is included in our platform, is that, there are going to be families, there are going to be children where, getting vaccinated is not part of their reality at this time. And so we do have a plan in place to work with those families and work with those children so that they're not missing school. At the end of the day, getting kids into school, getting children and youth educated is of primary importance. And but so is science, and so is keeping our community safe.
Thank you. Laura May, in what settings would your plan require vaccinations?
Thank you again for that question. It's interesting that that question is being posed to us as politicians. I actually think that the question should be posed to healthcare experts that understand why it is that we need to be vaccinated, the impact of that vaccine, when we should get a second dose or a first dose, or if we need a third dose, all of that kind of stuff. But the fact that that question is being brought up in a conversation from business owners, from the chamber, indicates to me that there were some really big issues with the way that the Conservative government led us through this pandemic. That decision never should have been made by political leaders. That decision about vaccines really should have been made by healthcare workers. But when a healthcare system is starved in the way that it had been for decades before the Conservative government in 2018, and then cut even before the pandemic by the Conservative government, then you end up in a situation like this where questions on the ground that I was receiving was, who is it that's creating these mandates? Is it the premier that's deciding from a political space to politicize our health? Or is it the health experts and the science table that were supposed to be guiding us to health? So I do think that it's important for us to ensure that whoever we elect, whichever party we elect in Kitchener Centre, as well as across the province, that you elect somebody who's willing to recognize where they do have expertise and where they don't. Because I have my doctorate in education, but folks, I am not that. And so I imagine different moments where healthcare issues arise, and I would never be the one that would decide what that health strategy should be. So there has to be an investment in public health, so that as and when something unexpected happens, like the pandemic, we can rely on those experts to do that work. And we all that we have at Queen's Park doesn't operate from a place of fear, because I believe that there was a lot of sort of stirring fear from the leadership of the province that then on the ground translated in people questioning the science and the healthcare providers. And so I really think that we have to use that opportunity to review what happened during the pandemic to make sure that we have the right people making the right decisions when it comes to healthcare.
Thank you. One measure that we can deploy without otherwise disrupting businesses and society is masking. And although we have found in our communities that that measure can be annoying, it is a proactive use of masks that will reduce the risk of reactive restrictions like shutdowns. How does your plan anticipate the use of masks going forward? Kelly, we'll begin with you on that question.
Thank you for that. I would say, we are continuing to follow the advice and direction of the science table, because, as Laura May just pointed out, that's who we should be turning to. And we are, as a party, we review it regularly, to make sure that when we are interacting in the community, when we are presenting ourselves as candidates and as a party, that we are following the best measures possible to keep ourselves and the community safe. And at this time, masks are our priority, and certainly something that we continue to.
I think Kelly's internet froze there for a second, so um, I apologize for that. But we'll move on with Laura May, and then when Kelly's internet fixes up, we can have her finish her thought there. So, Laura May, when it comes to masking, how does your plan anticipate the use of masks going forward?
Thanks for that. So part of our plan for the Ontario NDP is to invest in healthcare, invest in public health, and ensure that our public health units have everything that they need to be able to make the best decisions. Sorry, I just noted that Kelly's camera came back on. Can I pause? I'll stick a pin, as my people say, and send it over to Kelly. Okay, sorry.
Sure. Yeah, Kelly, we can have you finish your thought. Just your video froze there for a sec. So.
For sure, and not sure where it froze, so my apologies again, folks. It just, yeah, the love that we, one of the joys of the pandemic gave us this opportunity to meet virtually, and then it certainly unsettles you in the midst of something as important as this. So anyhow, I will leave it because I know, Laura May, you were in the middle of your thought, and thank you for putting a pin in it. And just to say that we will continue to follow the advice and direction, because I think that that's our best move forward.
And we'll go back to Laura May to finish her thought now.
No worries. So part of the Ontario NDP's plan is to invest in healthcare and invest in public health care in particular. The reason why that's important as we're talking about masking is because what we did see in wave after wave of the pandemic is that different regions were also impacted differently. And so there were moments where for Waterloo region, for instance, we had to either maintain some health measures or we could let go of some health measures depending on what was happening on the ground. I can't help but, in order to answer this, I feel like I'm being repetitive, but I need to go back to my response to the last question. I don't think that it should be the politicians that you're electing that are making decisions about mask mandates. I think it has to be healthcare experts and science that makes some of those decisions. Science guides the healthcare experts tell us what to do, and we as the political officials ensure that you have access to what you need to stay safe. If we starve the healthcare system and if we underfund public health, then it stands to reason that they will have no choice but to put mandates into place to mitigate not the healthcare crisis, but being starved of the tools that they need to be able to keep us safe. And so for me and for the party, the Ontario NDP is committed to making sure that we fill the gaps of the starving of that healthcare system so that the experts in health are the ones that guide the next steps, whether it's through the end of this pandemic or any other unanticipated health crisis that we might run into.
Thank you, Laura May. Wayne, when it comes to masking, how does your plan anticipate the use of masks going forward?
Yeah, I'm reiterating a lot of points of my fellow candidates. We got a look at the science table. The problem is there's very little data for them to work with. So, it's a bit going blind even with expertise at the table. for me, before the pandemic, I traveled a lot for my work. There are many places in the world where it's quite common to wear a mask if you're feeling sick. You know, it's a very low cost preventative way to prevent other people from getting sick. A very more community focused lens, and the Green Party really likes looking at health in a preventative lens as well. It's low cost, and if you feel sick or if you don't want to help, spread anything that you might have, it doesn't have to be COVID, it could be anything. You wear that mask, you can wear that mask. Me personally, when I canvas, I wear a mask even though it's outdoors, because some people may feel uncomfortable. If they want to see my wonderful face, I can bring it down, we can have that conversation. But I think going forward, because the science table has so little to go on, metrics wise, I can see the current structure of rules staying in place, and there may be more of a culture of people who do feel sick to wear masks to prevent other people from getting sick. And I hope just at a higher level we have a more communal feel of how we treat others, a more caring future. That's how I see masking working towards the future.
Thank you, Wayne. Hospitality and tourism were among the sectors hardest hit by the pandemic, and they are still hurting. How will your plan bridge the hospitality and tourism sectors through this crisis and ensure it continues to deliver to our shared prosperity? Laura May, will begin with you on that question.
Thank you so much. Another really important question. I don't know if people know, but there are a number of committees at Queen's Park, and you're sort of assigned to a particular committee. I was not assigned to the Finance and Economic Committee, but when they developed an expanded committee for finance and economic recovery for the pandemic, I inserted myself at that table. And part of why I did that was because I was already hearing from hospitality about the impact of these closures and the uncertainty about what would happen if the government wasn't clear about the safety measures that were required as we were trying to figure out what was even happening in those early days. What the NDP is guaranteeing is that there will in fact be financial investments in small businesses, in arts and culture, in the hospitality industry, in all of the industries that were deeply impacted by the pandemic and the closures and opening and changes in health decisions, et cetera. We're also wanting to make sure that as we recover, people have what they need should anything change, because that was something that we kept hearing at that table, that people they would invest dollars into ensuring that they had the preventative measures to keep folks safe. And then they would find out that the government had changed their mind about what they needed next, and they weren't necessarily getting money back for what they had already started to change. And so ensuring that we've got 2 rounds of small business recovery grants, with one payment in 2022, another in 2023, should help us to be able to navigate the next steps. It's also important for me to emphasize that there were a lot of issues with the way that the Conservative government put out their small business grant program. I spent a lot of time writing to ministers, trying to find out why small businesses, folks in the hospitality sector were being denied access to grants and support when they qualified according to what was on the website. And then I was being told that some of those rules were kind of changing and a little bit in a gray area. So we've got to make sure that the plan that we have, that there is clarity about when the grants are available, how one accesses it, and that you get that in a timely manner so that you can, in fact, ensure that you can keep moving no matter what it is that happens next.
Thank you. Wayne, when it comes to hospitality and tourism, how will your plan bridge the hospitality and tourism sectors through this crisis and ensure it continues to deliver to our shared prosperity?
Yeah, because hospitality and tourism is a large chunk of our economy. A large part of that is ecotourism. It's a Green Party, right? So if we have like conservation areas and having people be able to access it and to understand and enjoy it, that is a big part of what draws people to Ontario to discover it. So we would like, we would like to develop a lot of the conservation areas like that and help our hospitality and tourism industry. A lot of what I have in mind is not specifically related to hospitality and tourism, but things to help small businesses get off the ground, like some sort of commercial rent control, so they have a little bit of uh, predictability when it comes to their operating costs. And some sort of mechanism to enforce those rules and resolve disputes because fluctuations in TMI, the taxes, maintenance, and insurance, can be quite punitive, especially with everything reopening at the same time. And part of commercial leasing that would help with that is standardized leases. I would also want for, like, for example, the wineries down by Niagara, if we could allow alcohol producers to sell from offsite stores, to give them a few more tools in order to develop their industry. And that's just a few examples I can think of off the top of my head from hospitality and tourism. Um, I think there's some specific things in the Green Party platform about encouraging local tourism, but unfortunately, I don't have that ready off the top of my head, but it's something that if someone wants to ask me in the future, I'll have the resources to explain it.
Thank you, Wayne. Kelly, will end with your answer on the hospitality and tourism question on how we move forward with them.
Fantastic. I would say that every small business that I spoke to felt abandoned. Those were the words that they used to describe how they felt their government was there for them and that they weren't. And so moving forward, and I think we talked about some of the opportunities that the Liberal government is prepared to move forward in terms of paying attention to the needs of small and local business. And one of the things that I'm really proud of is that we have an economic dignity plan where we are talking about ways to prop up and support our small and local business with things like 10 paid sick days for all workers. I mean, those are things that will help keep our workplaces safe. That was eliminated 4 years ago and was such an important introduction to what we were hearing that people need. We also want to talk about raising minimum wage to $16 an hour as a starting place, and then look at how do we make that applicable across our province. But also, I want to talk too that we do know that the City of Kitchener has a Make It Kitchener 2.0 economic development strategy. And I think our municipal government is probably one of our big partners in all of this. And they've certainly put some investment and time and thought into what is going to help generate the economy, generate the tourism and hospitality industry locally, and really looking forward to partnering and working alongside, as we always have, with our municipal partners.
Thank you, Kelly. Our next set of questions will come from the healthcare sector. Do you support or will you honor the recent commitment to building new hospital infrastructure in Waterloo region? I think I lost where I was at, but I do believe that it was Wayne that can answer this one first.
And in short, yes, absolutely. We don't have a trauma center here, nor do we have any sort of pediatric center. And I think all of us at one point has met with the various presidents of the hospitals in the region. And there is a plan in place to bring more of that infrastructure in. And for sure, I think we're on agreement that we would love to see it happen, like, let's bring it. um, but it's important to also remember that, these buildings are just buildings if we don't have people in them. So we have to invest back into the people that run everything, or else they're kind of just beds. We need to properly fund our healthcare system. We need to repeal Bill 124, which I think all of us have also all support, and pay our healthcare workers, our PSWs, our nurses, doctors, even our morticians. Like there are different fields that all need shoring up. Our paramedics also as well. So yes, I agree with our commitment to our continued expenditures on healthcare infrastructure in the region, but we need to remember the people who run it as well.
Thank you, Wayne. Kelly, do you support or will you honor the recent commitment to building new hospital infrastructure in Waterloo region?
And I would say absolutely yes, and you will actually find that commitment to Waterloo region within our platform. But to support what Wayne is saying, and to reiterate that healthcare is about a system, and it's not about beds. And Waterloo region is growing, and our healthcare infrastructure and system is not keeping up to the needs that have been presented, right? I don't know that we're at a place where we could say that we are currently meeting the needs of our community, and then our ongoing needs. So we need to start to project forward what that's going to look like. But this also involves not only investment in the hospital infrastructure, but mental health. We need to look at our healthcare system as very broad. It's about making sure that we're alleviating the backlog of surgeries that we are hearing from people that has been causing a great amount of stress. We need to be looking at how we are investing in mental health and systems, and we have a commitment to do that. It is in our platform that we will be investing in the infrastructure. We will be investing in the people by repealing Bill 124, and we will be investing in eliminating and reducing the wait times. I don't know how wait times could ever be eliminated. I think that will always be, but we don't have to have a healthcare system that we have now. We need to restore confidence in our healthcare system that has been so poorly lost over the last 4 years, and not because we don't have people that care. We do. We have a system of nurses and doctors and PSWs and people who gave, we saw that over the pandemic, gave time and again more than 150%. When they were exhausted, they stepped up, they dug deep, and they gave us more. And for that, I am truly grateful. But we need to do our part. We need to come back and build the infrastructure, build the confidence, build the budget that manages and supports that respect that is so well deserved.
Thank you, Kelly. Laura May, do you support and will you honor the recent commitment to building new hospital infrastructure in Waterloo region?
Absolutely. Again, people may not know, but my colleague in Waterloo, she was the former MPP, Catherine Fife, she and I wrote a letter to the government actually in support of the ask from the local hospitals for the planning dollars that was recently announced, or that were recently announced. So that also has found its way into our platform, which is fantastic to hear. But I also want to draw on something that Wayne had said, because what we did learn from the pandemic was that hospitals provide emergency services and shouldn't be relied on as the crux of our healthcare system alone. If we think about preventative care, then we've also got to look not just on supporting the ask from our local hospitals to expand, but also what do the other healthcare investments look like to ensure that we're preventing people from seeing the hospital as their only option. And so I also want to point out that within the NDP platform, there's a commitment to an immediate 8% funding boost for frontline mental health and addiction agencies, as well as stable funding, because we've seen in Waterloo region that the opioid crisis, for instance, has taken us by storm, and the dollars from government to help prevent and support people has not been there to keep up. And there's also a commitment to expand Ontario's community health centers by adding 20 new centers or satellite centers in communities that are in need. And within that portion of the platform, they've also highlighted particular communities, for instance, Indigenous communities, Francophone communities. when I was reading that, I got excited because that's a moment where I, if I'm the person that's elected in Kitchener Centre, can advocate for the healthcare hub for Indigenous communities in Waterloo region and in Kitchener in particular. I want to just make sure that I emphasize that, because oftentimes Indigenous communities are imagined to only live in far north remote communities, when we've got Indigenous community members that are right here in Kitchener Centre that are fighting for access to healthcare needs. And if we interpret our platform pieces in creative ways, then whoever it is that's elected, so in this case, if it's me that's elected or re-elected, and I can then take that portion of our platform and fight for provincial funding to support the advocacy being done by Indigenous communities in Kitchener Centre and across the region.
Thank you, Laura May. Our second question, and we'll begin with Kelly on this one. What is your plan to address our local shortage of physicians?
So we need to acknowledge that there is a shortage. And one of the things that we're looking at is making sure that we are understanding where internationally there are opportunities for us to bring individuals into our region, into our province, to be able to deliver that health care. We have talked about coming to the table to look at being a stronger partner with our federal government around immigration and finding the skilled workers that we need within our province, within our region. But for me, it also goes hand in hand with making sure that our community is set up to be welcoming and inclusive, as we're, letting people know across the globe that we need your expertise in our community. And so making sure that we are a place where people see themselves, a place where they want to grow and be a part of our community.
Thank you, Kelly. Laura May, when it comes to the local shortage of physicians, what is your plan to address that?
Thank you for that. Our plan is sort of twofold. On the one hand, we also speak about internationally trained physicians. I can tell you that we don't even have to rely on newcomers, like dealing with the federal government and building those relationships to bring people here. Internationally trained physicians are here. Some of them reached out to me during the pandemic, and they were mortified to find out that when the Ford government said that they needed these physicians, that they were being blocked from being able to assist, even though they had the skill set. And part of what that block looked like was not allowing the time that they were helping on the front lines to go towards there being permanent physicians in our community. So I had local internationally trained physicians ready to help that weren't able to participate in bringing us all a more healthy environment and getting us through this pandemic in tangible ways. And so the accreditation issue with internationally trained physicians is more along the lines of what the NDP is fighting for. There was a bill by my colleague in Scarborough, Dolly Begum, that we had tabled that we would definitely ensure became law, so that we could address some of the gaps that actually stall internationally trained folks from being able to use their skill set here. Given how large of a settlement area Kitchener is, that's really, really critical to addressing the physician shortage. And the second part is to be honest about what happened during this pandemic. We had a number of people leave. I think one of my early calls actually was from a local physician who chose to retire and close their doors because they felt, not having access to the PPE that they needed, they were putting the public at risk, and they weren't able to do their work without being provided with what they needed to keep the community safe. And so if we know in that sort of review of what happened during the pandemic, that a lot of skilled physicians and health experts left the field, then it makes us have to emphasize even more the repealing of Bill 124, because that bill was another sign from government that we didn't value the health expertise that was here, that we didn't value the entire infrastructure, because a physician doesn't just work on their own. They work alongside nurses and PSWs and other healthcare practitioners. And so we've got to make sure that we signal from our vantage point as elected officials in the provincial government that we care about the healthcare system, or else we will not be able to retain any of the physicians that we need. And we'll start to see bigger and bigger gaps when it comes to families that also reach out to my office asking for a way to get on a list to find a family physician. The last thing that I'll say about that goes back to something that Wayne said again, and I can't emphasize that enough, and it's prevention. Physicians being available allow us to prevent major illnesses that then put a huge burden on an already starved healthcare system, with people having to go to emergency rooms for something that if they had been able to take care of, or been alerted to a health issue that they'd been alerted to prior, they wouldn't have to go into emergency. So we've got to make sure that we address this in a more holistic way and understand how all of these pieces connect.
Thank you. Wayne, what is your plan to address our local shortage of physicians?
Yeah, this is something that affects a lot of people, like even my peers and coworkers. Some of them have been on Healthcare Connect for years in this region. And I think I'm going to be echoing a lot of things I've already been said. The first thing is the accreditation part. I have also been reached out to about foreign trained healthcare professionals who don't have that pathway to accreditation to meaningfully practice in our healthcare system. And I really hope that, we can give them more pathways or abilities to become practicing physicians that, that can contribute greatly to our society and help us specific needs. But there's also a bit of doctors that are accredited at home. There's a pretty severe shortage of residency spots. So although there has been a lot of shoring up from medical school, these med students need placements and residencies before they can start practicing. And a lot of these are limited. So we'd have to work with different hospitals to bring in student physicians and help them attain the practical skills they need to do residency. So I'd really hope for focus on that part for the people who are trained in province. And lastly, I've had physicians come to me directly about how they feel squeezed. Now, from how I see it, doctors, like the doctors that you go out to, are not paid directly. They are actually paid through a medical corporation. The medical corporation pays for maybe some salary they may take out themselves, but also for their equipment, for the staff of their healthcare team, for their insurance, for their rents. And let me tell you, the rents have increased quite a bit. The insurance amounts have increased quite a bit, and the amounts that medical corporations have been compensated for haven't moved very much at all. In many governments. So a lot of physicians feel squeezed. They feel they want to provide the best care, but they are not empowered to do so because of how the system is structured. So shoring up even that part and maybe trying to figure out how other jurisdictions have done it that have incentivized providing the best healthcare team for their patients. I think it's something that we should really look into more than just funneling more money to it. Maybe there's a smarter way in which we can help patients enable better care for their doctors, better patients, better care for their patients.
Thank you, Wayne. Our next question is, per capita, Waterloo region has the fewest hospital beds in Ontario. What's in your plan to improve the situation? We'll begin with Laura May.
Thank you for that question. It's important to note that within the NDP plan, there is a plan to invest to get more beds and ensure that we have access to what we need no matter what happens. And that's sort of a given. I'm pretty sure that you're going to hear from each of us that that's embedded into our platforms, especially because we're dealing with a post-pandemic recovery situation where we have to make up for the gaps that we've all seen. But I think that what we also need is to step back from from that sort of reactive response to the healthcare crisis that we're in and talk about prevention. Because a lot of the reason why we're in need to fight for more beds is because we don't have enough money invested in the broader swath of our healthcare system. So what I'm most excited about, one of the things I'm most excited about in the NDP platform is, for instance, putting mental health under OHIP, ensuring that people have access, especially now because people are struggling after everything that they have been through, both personally and professionally throughout the pandemic. If they have access to the mental health support that they need, if they have access to addiction supports that they need, then it won't put such a strain on the hospital system, and the focus doesn't necessarily have to be on beds and emergency type scenarios, but instead can be on managing one's health issues, managing the impact of the pandemic in a way that makes people thrive. And so I just wanted to make sure that I kind of brought in that more holistic vision, because that's actually what you'll see when you look at the NDP platform. On the one hand, we're fixing and addressing some of these longstanding gaps in the healthcare system, but we're also providing a vision of what life could look like if we weren't always reacting to a crisis, but instead we're able to thrive and grow and navigate our health concerns, and also mitigate some of those health concerns when provincial governments don't invest in healthcare and public healthcare in particular.
Thank you, Laura May. Wayne, per capita, Waterloo Region has the fewest hospital beds in the province. What's in your plan to improve this situation?
And just echoing a lot, yes, we would support another major healthcare facility in our LHIN that includes Waterloo and Wellington. And the works are already in the place because it is one of the lowest in the province. But that's just infrastructure and not necessarily the people. So, training the people and paying them what they're worth is part of it. And also, echoing Laura, seeing healthier preventative lens. So there may not have to be the same amount of burden on our healthcare system if we are preventative in it and how we look at it. And things like housing insecurity is bad for people's health. Social isolation is bad for people's health. Poor nutrition is bad for people's health. There are stories of people going into the emergency because their stomach really hurts, but it's because they haven't been able to eat. And if we were to attack it in a preventative lens and having those supports around them so people didn't have to make those decisions, because let me tell you, ER visits can be quite expensive for the province. It is morally, is a moral improvement to have a preventative look, as well as a fiscal improvement to have that preventative look. And the beds per capita may be lower, but if everyone as a society is healthier because we have preventative parts like better access, equitable access to active transportation, to green space, to having the tools to be able to age in place, that puts a lot of pressure off our healthcare system in a if we look at it at a preventative way. And that's just my thoughts. But of course, we do support another facility here in our very quickly growing region.
Thank you, Wayne. And Kelly, what is your plan to address the physician shortage, the hospital beds in Ontario?
Perfect. So as I've shared, that is very clearly laid out in our plan, and Waterloo Region is mentioned, and so there's a few things to look at here. There's certainly this backlog of supports and surgeries and services that are needed because people have had to wait, and so there's going to need to be an immediate investment to be able to help people along in their health journey. I know of people who have had to postpone their hip replacement surgery, and if you know of anybody who's waiting for a hip replacement, the pain management takes a huge toll. So we really have to invest in being able to clear some of that backlog. But we also, are recognizing that we are a places to grow, that Waterloo Region will be growing. We are growing. And if I'm lucky to represent you as an elected official, I will continue to make sure that that is heard at the table and in our plans moving forward, that we need to be investing in Waterloo Region to be able to keep up to pace. And the final thing I'll say about that is we also need to invest in the people that make that happen. We need to make sure that healthcare is a place that people want to work, that people feel safe to work, and that is a responsibility that we need to take on to make sure that what we are doing creates a system that allows for all of that to happen, and that we pay people accordingly. As we've talked about it, I think we're aligned. Repealing Bill 124, I don't think can come soon enough. I think that was disrespectful, and certainly has impacted our ability to value and in a meaningful way all of those healthcare professionals that we rely on. But the Liberal Party is also about not privatizing healthcare. And I think that that's one of the things that we've talked about as well, is that this is a public system and it needs to be maintained to do so. And because that is what is important for all of us as Ontarians, is to be able to have access to equitable healthcare.
Thank you, Kelly. Our next question with healthcare is, there hasn't been a hospital built in Waterloo Region in 60 years. Will you support this area's request for about $12 million for a study to quantify and prioritize our healthcare needs to the Ministry of Health? Wayne, will begin with you on that question.
Absolutely, but I believe the hospitals have already done a lot of this research for us. I don't know if we need to go to committee and then understand it and then assess it and pilot, and like, I think the needs are pretty clear, even just from a simple metric like beds per capita. Yes, we would be, uh, we would love to see another hospital, because it has been 60 years and a lot of these hospitals do not have the modern approaches to accessibility that we better understand today. I believe in most of our hospitals, a lot of the washrooms can't even fit a walker, because that just wasn't in mind back when hospitals were constructed. So yes, I think we could greatly benefit from a new facility with the latest in understanding of how we build health infrastructure and healthcare buildings. Do we need another study? I'm not sure, but because I would have to see the details of what has already been done and just hope that we don't have to reinvent the wheel, because I'm not quite certain the depth in which the hospitals have existingly looked into it. But yeah, we need another facility, as simple as that.
Thank you, Wayne. Kelly, do you support that as well when it comes to a new study to quantify and prioritize our healthcare needs to the Ministry of Health?
Well, I think it's quite clear right now, and that we do need that. When I met with Communitech, they have the peer-to-peer network, that was brought up, and so the information exists, and I think that we can rely upon that to develop our plan moving forward. It's it's no secret that we are a growing region, and so really it is about how much do we need, where does that, what does that look like, and then how do we have that continuum of supports, and we also talk about a health innovation network within Kitchener Centre, and I'm really excited to see that unfold and take place over the next little while.
Thank you. And Laura May, would you support the area's request for the study to quantify and prioritize their healthcare needs?
Thanks for that. I think that we have to. I think when you take these two pieces of information about Kitchener Centre, it becomes really clear that is the pathway that we have to take. First is that we are one of the fastest growing regions, which means that there will be more people that require support and health and healthcare and access, which you can't have if you don't have enough of that infrastructure to be able to provide that. But the second is the fact that the record recently reported that Kitchener Centre in particular has the highest poverty rate. So that 16.5%, I think it was, is in Kitchener Centre. A lot of physicians and a lot of health experts have talked about the need for public public hospitals and the elected officials to understand the social determinants of health. If we are living in a riding that has the highest poverty rate, then it stands to reason that we also will have constituents, a higher number of constituents who rely on the hospital system and our healthcare system in order to be able to navigate their health. And so I think it's important for us to provide the investment to the health leaders locally who are already telling us that we need to move in this direction in order to better support community, and allow them to guide us in figuring out exactly what that infrastructure will look like. Because I think in general terms, we know we need a hospital, but unless you start to connect the dots amongst those health leaders, we don't know exactly what that means on the ground. And this study will provide that information so that we can make sure that the proper investments and strategic investments are made so that that hospital is doing and providing the care that we need in community, thinking about the social determinants of health and also thinking about the impact of the pandemic on the healthcare system locally as well.
Thank you, Laura May. We'll move on to the next category, which is private sector growth. The Greater KW Chamber of Commerce fully supports the call from the Ontario Chamber of Commerce for a commitment from all parties to not raise taxes on businesses. Will you make that commitment? And Kelly, we'll begin with you on that question.
Thank you. And we would support that. We actually have in our plan that we will eliminate corporate taxes for small businesses for the next 2 years. And what I do know is that in the development of this platform, we have consulted with the community, we have consulted with stakeholders, and got, made sure that we accessed information from the community, from small businesses to help with the development of this portion of the platform. And so moving forward, we will want to hear from those community, those small businesses again around paying attention to their needs. Because they've been forgotten, and because for me, our small and local business are the life of a community. They bring the character. They are also the ones that we turn to when we need supporters in our other organizations. They are always the ones that step up with their sense of community and their sense of community involvement and philanthropy and giving back. And so this is a time for us to step forward and say, times have been tough, and here is what we can do to support you.
Thank you. Laura May, the Greater KW Chamber of Commerce supports the call from the Ontario Chamber of Commerce for a commitment from all parties to not raise taxes on businesses. Will you make that commitment?
Thank you so much for that. I think it's important to recognize that part of our job, whoever it is that's elected in Kitchener Centre, is to advocate for our community within our party, and then as a party, push them to advocate, if they're government, to make laws that protect small businesses and other kinds of key issues that are impacting us. If they're opposition, which is what I was for 4 years, then it's to make sure that the government is paying attention to what's happening in our riding and in our region. And the reason I'm starting there is this. Within our platform, there is talk of taxes for business, but for businesses that are making loads and loads and loads of money, not the small and medium-sized businesses that are throughout the Kitchener Centre community and in Waterloo region. And I think it's important for us to make that distinction, because one of the things that I did hear during the pandemic was that when people could pay more or where they could invest in helping community, they wanted to. But it was the small businesses that were being lost in all of this, because the Ford government was focused on bigger business. He was focused on making policies that would allow these big businesses to thrive despite the pandemic, while forgetting about the mom and pop kind of shops, forgetting about the arts communities, forgetting about the social entrepreneurs and the other more innovative businesses which are hopping all throughout our riding. And so I think that the reason I wanted to sort of make that distinction is because there often is an assumption that the only way that we're going to get the revenue that we need is if all businesses are treated as one and all businesses have the same kinds of measures taken so that that revenue comes from there, when the reality is there's nuance within the platform. There's nuance that recognizes that these small businesses need investments. They need to be able to recover where they've sort of held on by a very thin thread, and they need to be able to rebuild. Because I also saw a lot of, or heard from a lot of business owners that had to close their shops and are now trying to figure out whether or not they're going to reopen and what that might look like. Or they had to pivot to a different kind of business model because they were trying to navigate a highly virtual environment when they used to be sort of an in-person kind of space. So my job and my role would be to keep hearing from the business community so that I can bring that back to the party, and to look at the platform and advocate for what's needed in our local community. And I'm happy to do that kind of work for Kitchener Centre. Sorry, James, you're muted.
Sorry. Wayne, I'll reiterate the question to you. Would you make that commitment from all parties to not raise taxes on the businesses?
All right, I think I'll just get directly to the answer. Small and medium businesses are the lifeblood of our community, and it really helps cycle the community. So we would not raise taxes on that. However, it's part of our plan to increase corporate taxes by 2% over 4 years for large companies who intake massive amounts of revenue. So we're not talking about your larger revenue businesses in Kitchener Centre or even within Waterloo region, but a lot of these huge multinational companies to pay for a little bit of the revenue required for some of the ideas we have about the future we want. Most of what we have in mind is still investing in people, so they're able to lift themselves up and not be trapped. And with that comes good jobs, with that comes income taxes. But a part of kickstarting some of the ideas we have right now is that corporate tax increase we would like of 2% over 4 years for large revenue companies. It's part of we did the costing, and some of these promises do cost money, and we felt a part of this part can help go a long way to lifting the lives of a lot of people.
Thank you, Wayne. We'll move on to the next question. Tens of thousands of businesses in Ontario have gone bankrupt over the past 2 years, and the average small to medium-sized enterprise has added almost $200,000 in debt. Consumer behavior has not returned to pre-pandemic patterns. What is your plan to support businesses emerging from the pandemic, and how will that support be targeted? Laura May, will begin with you on that question.
Thank you so much for that. I'm going to focus my attention on the language of consumer behavior. And the reason I'm doing that is this. When I was sitting at the finance and economic recovery table, what we kept hearing from business after business in sector after sector was that when the government was not clear in the health and precautions that were required for small businesses, they were unable to convince or encourage people, consumers, to come out to their business. And so it kind of didn't matter that the government would decide, today we're going to open everything up, because people didn't feel safe to join. And so from sector after sector, we kept hearing the government has to present a vision of it is safe out here, or else nobody will listen to us no matter how much plexiglass we invest in or how much PPE and hand sanitizer we have at the door. Nobody will come out. And so I don't think that we're able to provide small businesses with what they need to recover from the huge amount of damage that had on our economy, without also providing clarity to the public about the safety of attending some of those shops or attending some of those businesses. And so to me, that's part of that partnership and relationship that has to happen between government and small business in order to recover. Because at this point, when there's a lack of relationship, then the government doesn't listen to the small businesses and doesn't actually attend to what they need, so consumers come back. And without people actually buying products, then we're not able to recover in that way. Not locally, which was something else that I heard at that finance and economic recovery table. Local economies were so severely impacted. The timing of the shutdowns meant a lot of the festivals that we would have been at, a lot of those kinds of the arts and culture that actually encourage the tech sector to be able to retain folks there. All of that within that structure were being decimated. And a lot of it had to do with a lack of clarity about whether or not it was safe to go shopping or safe to go outside or safe to participate in the local economy. So I think that relationship building piece is key, and ensuring that consumers feel okay and safe about going into businesses is important. And most importantly, that whoever you elect is listening to the concerns that are being raised from the business community, so that we can incorporate that into policies and decisions that we make at that table.
Thank you. Wayne, what is your plan to support businesses emerging from the pandemic, and how will that support be targeted?
All right. I mentioned it a little bit earlier. A large part of our platform does revolve around commercial leasing. Maybe not a large part, but there's a section for it. Going forward, give you a bit more stability in terms of figuring out what the future is going to look like as a business, because that uncertainty is a huge dark cloud hanging over every small business. So allowing commercial rent control and standardized leasing, so there's no gotchas or hidden fine print, and a mechanism to enforce the rules and and resolve disputes. And I made a specific mention of the TMI portion, the taxes, maintenance, insurance portion. When it comes to that insurance portion, we also want to work with insurance providers to develop that affordable commercial insurance option targeted to specific needs of that business, but having a more standardized suite, I guess, if you want to put it that way. And this is how I feel we can target different types of businesses that exist within Kitchener Center, because insurance is a decent chunk of what it takes to operate a business, and making sure that it's fair and that the claims process is fair as well. Is a large part of how we see we can help small businesses in that recovery stage. There might be even something as small. Personally, for me, I work on the vendor side with a lot of public institutions, but because we are smaller and Canadian, sometimes it's really hard to win contracts just by the way procurement works. So allowing more access to public contracts for some of the amazing technologies that's developed right here in-house, even specifically in this riding of Kitchener Center, giving them that opportunity to access those public contracts and RFPs, I think is a great way forward to, having them have a good footing, having someone in their home court to advocate for them, and hopefully help them expand to become world leaders.
Thank you, Wayne. And Kelly, when it comes to supporting businesses emerging from the pandemic, how will that support be targeted?
Thanks, James. I think of kind of the cycle, the life cycle of business. And first of all, I think that in our platform we talk about the business itself and injecting resources and supports for those businesses to develop themselves, to thrive. So things like eliminating the corporate taxes for small businesses for the next couple of years, those are things that we see that need to be implemented so that we can get our small businesses back on track, back feeling supported. I know throughout the pandemic that, you know, I would have many conversations in the community with different businesses, and the chaos about wondering even about, well, what do I do today? And you had to go through this whole menu of different options, and it's, if A is here and then you slide over here. It wasn't clear. We need clarity. Businesses need support so that they can quickly understand how they can maneuver and adjust so that they can continue to meet the needs of the consumers that they have chosen to support. That's that, as we talk about that cycle, it's also those consumers. And so our plan also talks about eliminating HST on prepared foods under $20, and it may seem like an odd thing to do, but these are things that we have the capacity to do to try and bring businesses, bring people back to feeling comfortable, to feeling that it's affordable, to be able to generate income in that way. And finally, our platform also talks about having self-employment as a course in high school, right? So how are we leveraging and mobilizing and inspiring a new generation of business owners? And starting at high school is probably a pretty good place to do that.
Thank you, Kelly. We're about 8 minutes away from ending, so we will go to closing remarks from the candidates. So it'll be in reverse order from the opening remarks. So we'll begin with Laura May Lindo with her closing remarks.
Thank you so much. And thank you again for creating this opportunity for us to come together and share some of the important pieces of our platform with all of you. I noted in the chat that there were some discussions about housing, and I think it's important for me to use this last little bit of my time to just touch on some of that, because when I speak about the social determinants of health, I'm also speaking about ways to ensure that we have a healthy economy, and you can't have that if you don't have a place to call home. I think it's important to note that we have a fulsome housing platform. It was released well before the election platform as well. And part of what's important in there is to ensure that we reinstate rent control, that we make sure that new buildings have accessible units, that we look at deeply affordable units for people. I think there's an understanding or a stereotype that if people are on ODSP or OW, that they absolutely do not want to work or participate in their local economy. But what I was hearing in the time that I was elected was that they did want to, but it was policy that stood in the way of them being able to do that. And so when we think about what we need to build our economy and build our communities, I think we need to focus on the most vulnerable and ensure that policymakers, if it's me that's elected for Kitchener Centre, or if it's one of my colleagues on the call, or even somebody who might not be on the call, it's important that we fight to ensure that we support the most vulnerable in everything that they need. When we support the most vulnerable, everybody thrives. And so I'm very, very grateful for spending some time with you this afternoon.
Thank you very much, Laura May. Kelly, we'll go to you for your closing remarks now.
Well, thank you so much, and thanks, again, for the opportunity to present, ideas from each of our platforms, and from my platform, the Liberal platform, and also to share some of the things that I've seen and heard and experienced as I've talked with people, as I've made my way around Kitchener Centre, and the experiences that I've had over the last last little while, understanding what is important. And one of the things that I've really come to understand is that there is a diversity of experience across the riding of Kitchener Centre. And we've got kind of the communities of Westmount to downtown to Stanley Park to Lackner Woods, and there are so many interesting conversations to have within those communities. But one of the things, that there are some consistencies. We see that affordable and attainable housing is important to everyone. We hear that there are concerns from older adults about their future. What does that look like? And is their government going to be able to be there for them when they need us the most? And we talk about care and commitment to our education system. Who are going to be the stewards that make sure that our education system not only has safe infrastructure, but that we are able to inspire educators, that we are able to create a safe space for our children and youth to learn. And then we also need to talk, people are concerned about the climate. As we talked a little bit earlier, we're experiencing some extremes in our weather, and are we doing enough to make sure that as we look forward, and as we plan forward, that our climate, that our environment is going to be there for us in a way that we need. And we need to make some changes. And so I'm really excited to be able to be listening to people, to learn, to be able to be at this table and share some of those ideas and experiences. And I thank you for that.
Thank you, Kelly. And Wayne, we'll go to you for your closing remarks.
All right. And I thank you so much for giving us this platform and for us to all talk about our platforms. I guess that rhymes, or it's the same word. And I encourage you, like, this is still not enough time. All of us have different ideas that we bring to the table. So I encourage you to all research and see what we have to say. I know if you caught me at the door, you've probably caught me talking about housing all the time. So it's not something I can squeeze into a minute. Let's just say it's not just building, sprawl, 50-cell sprawl, drive till you qualify, but we need to mindfully think about how we build our communities, how to make sure that they're connected, prioritize that idea of a 15-minute community where everything you need is within 15 minutes, where you work, where you shop, where you hang out with friends, and build the infrastructure so you don't have to commute, so you don't have that long drive between places. So building housing with communities in mind, and also bring back nonprofits for the affordable part. Okay, I'll move on to the next thing. Our housing platform is 67 pages, so condensing it can be hard. Things like our mental health plan. We were one of the first to have a completed specific mental health plan, and now lots of people are talking about it. When it comes to environment, we have a climate plan that is serious, written by the last environment commissioner. It's big, it is costed, it's there. We also were advocating a lot for ODSP shore up, so not just doubling it, but reducing how the clawbacks work so it doesn't trap people, but lift them up. So you hear like all of these different policies where we put forward, and now everyone has been talking about it. That is what one MP could do. Imagine if there are more green voices there advocating, and that's what I'm really hoping for, me personally. So when you go to the polls, just think of that future you want, look at all of what we're proposing, and see what you feel works best for the Ontario you want to see into the future.
Thank you. On behalf of the Chamber and Rogers, I would just like to thank all the candidates for taking time from their busy schedules to participate in this forum. Thank you to our title sponsor, the Kitchener-Waterloo Association of Realtors, and the media sponsor, City News 570 and Rogers TV. And of course, I would like to thank everyone from the community for their attendance as well. If you're a resident of Kitchener Center, the election date is approaching rapidly, so please ensure you're aware of voting location. The Chamber and Rogers hope this forum has provided some relevant perspectives on your issues of concern. Thank you very much, everyone.